Hi, good afternoon, everybody, and welcome to this Centre for Ageing and Dementia Research seminar. My name is Charles Musselwhite. I'm the co-director of the Centre for Ageing and Dementia Research, along with Andrea Tales. We work out of Swansea University, but the project CADA, the Centre for Ageing and Dementia Research, also involves Bangor University. We're funded by the Welsh Government through the Healthcare Research Wales funding arm. Well, our aim is to bring together everybody who's working in ageing in Wales to share best practice, to share research practice, and to try and make a difference to older people's lives, or to all of our lives as we age. Absolutely delighted today to have Matthew Roberts and Janine Evans with us to give us an overview of their burn injury prevention practice and research they've been involved with. We're going to hear from them in a little while. Anybody who wishes to ask any questions for Matthew or Janine at the end, please place them either in the questions box, type them into the questions box, or the chat box on the right hand side of the GoToWebinar session there, and I'll try and pick out the best of those to ask them at the end. We've got until about 2 o'clock. We may need all of that time. We may be able to finish a little bit before that, but let's see how we go. All of this will be recorded and placed out onto the website and on our new YouTube channel. Do subscribe to that if you want to know any more details of the presentations that we're doing, and have a look at our website, which is cadr.cymru. Other than that, let me just quickly introduce Janine and Matthew. Janine is an advanced practitioner occupational therapist who has been working at the Welsh Centre for Burns and Plastic Surgery at Morriston Hospital since 2001, and I presume that's where you are now. Janine, that's not your home in the background there. And Matthew Roberts is a second-year postgraduate occupational therapy student from Cardiff University, supporting this project as a research intern. So great to have him here with us today. So perhaps without further ado, it's over to you two to run the show. I'll hide my camera and then come back and help field some questions at the end. Over to you guys.
Thanks, Charles.
Thank you very much. So just before we get started today, when you registered your interest in this webinar, you'll have been sent a link. We're trying to undertake a service evaluation where we give educational presentations to as wide an audience as possible, and then we evaluate the success or failure of that presentation through a questionnaire. So I've just posted it in the chat, so if anyone who hasn't had a chance to have a look at that yet can quickly do that. We'll give you a few minutes to go through that before we dive in with the presentation. And if you have had a chance to fill it in, then thank you very much. And yeah, we'll just wait a couple of minutes if that's all right. I can post it again in the chat in case people haven't seen it. So should we give people till maybe 10 past? Do you think that's all right, Janine?
Yeah, just a couple of minutes will be fine. It's a really short survey, isn't it? It doesn't take long to complete, hopefully.
So while people are filling that in, maybe I can just run through a couple of quick housekeeping things for the webinar itself. Like we were saying, if you have any questions, please feel free to post them in the chat. We want this session to be as interactive and engaging as possible, and that only really works if you bring in your own personal experiences and share some stories if you're willing to, or reflect on those personal experiences in order to really bring home the message that we're trying to get across. So yeah, we're here today to talk about burn injury prevention for adults, older adults, specifically over 65, but the messages are quite universal and can be applied to people at every stage of life. So
I think perhaps we could start with the first slide, Matt, which is just introductions, and take it from there then.
Okay, so hello, good afternoon. My name is Matt. I'm a postgraduate occupational therapy student from Cardiff Uni, and I'm going to do the first bit of this presentation. So we're here today to talk about burn injury prevention. And first, I just wanted to introduce the team. The four of us have been working on this project for the last couple of months. So myself and Janine are here today. And also we have Laura Ingham and Catherine Purcell, who've been helping with this project, both from an occupational therapy background and with significant research experience. One's an associate lecturer and the other's the head of OT research at Cardiff Uni. So we will come at this problem from an OT background, and so just a general introduction to occupational therapy and burn prevention. So occupational therapists will work with individuals who've suffered a burn in order to help them maximize their ability to perform activities of daily living within their home as independently as possible. And we're also trying to educate individuals and their carers and their communities about the risks of burns and how to mitigate some of these risks. So that's the capacity that we're here in today as an educational. So why are we here? We're here today with a very simple key message that burn injuries are preventable. And we want to help individuals prevent avoidable burn injuries. So burn injuries aren't sort of freak accidents that you can do nothing to avoid. They are preventable in a large number of cases. We're here to explain and educate about the different types of burns and their causes. And we want to educate people who attend about the risk factors for burns and some basic burns first aid. I'm sorry if there's a bit of feedback. I'm not sure what's causing that. So why is this message so important for older adults specifically, so adults over 65? Well, the first reason is in recent years, there's been a significant effort to educate the public on how to prevent burns. Campaigns have been targeted at specific professions where there's a high risk of burn injuries, and at children who are very susceptible to these injuries as well. But for some reason, the older adult demographic has been largely neglected in this research. So we wanted to try and rectify that and try and help out that specific section of the population. So adults over 65 are more likely to experience a life-threatening burn than any other age group. And adults over 65 are more likely to suffer long-term physical difficulties as a result of these injuries. So that just illustrates how important this message is and how key it is to get it out there. So the reasons why older adults experience more life-threatening burns and more long-term physical difficulties are very complicated, but just a very brief overview. Some of the factors that are at play are physiological changes as the body ages. So things like a young adult will have skin that's up to 15 times thicker than that of an older adult. So when they come into contact with a hot surface or a flame, that skin is obviously not going to provide as much protection from the burn, and you're more likely to have serious consequences. Similarly, mobility difficulties can affect people over 65 and impair their ability to get away from a heat source or increase their likelihood of potentially having a fall in an area that might put them at risk. Also, we just want to briefly talk about underlying health conditions and medication, which can have side effects and symptoms which may increase the likelihood of an individual sustaining a serious burn injury. Finally, social isolation is a big factor, with more adults over 65 living by themselves and doing lots of things independently. You really need to educate about the risks and make people aware of things that they can do to minimize these risks within their own home. So now we just want to ask you, have you ever experienced a burn injury, or do you know anyone who has? So feel free just to think about this independently. A lot of people wouldn't like to share their own personal stories, but if you are comfortable or willing, then please feel free to put them into the chat and we'll address them at a later stage in the presentation. So now I'm going to hand over to Janine, who's going to talk to us about a patient she directly worked with a couple of years ago.
Okay, so I think by giving a patient's story really helps people to understand how it affects people on an individual basis. So we've got a short video to show you now. I apologise in advance for the fact that we don't think the sound is going to work, so I'll do a bit of a voiceover rather than hear the actual patient talking using her own words. So this lady was living alone at home. She's 83 years old and was independent in all activities of daily living, not requiring any support from family or social services. But unfortunately, one day while she was frying eggs at the hob, she had a seizure and ended up having a nasty burn injury to one of her hands. So if we just flip through to the next slide, Matt, and we'll have a little look at some of the images. So as I said, she'd had a seizure whilst she was cooking. So she didn't realise that the accident had happened in the first instance, and she found herself on the floor, unfortunately. Oh, and it looks as though our images aren't working on the video either. Working. Okay, I'm not entirely sure that the sound quality on that video was very audible, unfortunately. So just to talk you through it quickly, as I said, as she was frying eggs, she had a seizure, ended up on the floor. She's not sure how long she was out for, really, before waking up and discovering that she'd had this really, really nasty burn injury to her hand, which obviously was extremely painful. So she phoned her neighbour as quickly as she could to get some support, and he suggested that she phoned an ambulance to get taken to hospital. So we are a regional service in Swansea. We're the only burn service in the whole of Wales. This lady was actually living up in the Rhymney Valley. So although she was taken in the first instance to the A&E department in Prince Charles Hospital in Merthyr, they very shortly transferred her over to the Burn Centre in Morriston because of the complexity of her injury. So she needed to have a general anaesthetic and a big operation. The burn was so significant, so deep, that she actually ended up losing the end of her little finger and needing some skin grafting as well. And she was in hospital with us at the Burn Centre for about 5 weeks then, having rehabilitation after her operation to try and regain as much movement and function in that hand as she possibly could. Obviously, rehabilitation is not a particularly pleasant process to go through, so we had lots of issues with pain control while she was in. as you can imagine, and from seeing that photograph of her hand, burn injuries are one of the most painful injuries that you can actually experience. So this poor lady had a real time of it in with us for a long time as well. And then when she was transferred back home, she obviously needed to continue her follow-up with us on an outpatient basis. So we spent a lot of time with her, teaching her how to do her functional activities in a slightly different way, because her hand had been injured so significantly. She had to continue with exercises and stretches for a long time. So the 5 weeks in hospital was just the start of the process, really. She's still under our care now, believe it or not, 2 years later. That's how long it takes to rehabilitate from this type of injury. So they are very significant. As we said, largely avoidable or preventable, but obviously accidents do still happen. But she has since learnt that the best treatment for a burn injury is really good first aid. So even though she's gone on to sustain small, less severe burn injuries since she's been at home because of her reduced function in that hand, she knows now that cool running water within as soon as time as possible after having a burn injury is really helpful in minimising the impact. So, so luckily she hasn't gone on to sustain anything more significant than a very minor burn since she's been back at home.
So now I'm going to talk a little bit about the most prevalent types of burns among older adults. And I personally was quite surprised at this revelation. By far the largest cause of burns in adults over 65. So this data is gathered from the Morriston Hospital, Welsh Centre for Burns and Plastic Surgery, their 2019 statistics. And by far the largest cause of burn injuries for over 65s is scalding. So contact with hot water makes up 43% of all of the burn injuries that they saw in their inpatient and outpatient service. The second largest cause of burns is flame burns. Although these are in national statistics decreasing because less people now have open fires and things like that within their home. Among older adults over 65s, that's still a really prevalent cause of injury, and it's not just caused by open fires. So the third most common type of burn injury is a contact burn, which you can sustain by coming into contact with a hot surface. So that's 21% of the injuries. The final two groupings are chemical burns and electrical burns, which make up 6 and 1% respectively of all the burn injuries. So for the purposes of this presentation, we're going to focus on the three main causes of burn injuries, so scald, flame, and contact burns. And we're going to look at those in more detail in the subsequent slides. So scald injuries are often caused by contact with hot water, which might take place in a kitchen or in a bathroom. I mean, it doesn't necessarily have to be boiling water in order to cause an injury, as we'll talk a bit more about later on. Flame burns, like I said, often associated with open fires, but more frequently actually caused by incidents in the kitchen, whether it's food or oil catching light or items of clothing. And finally, contact burns are often sustained by making contact with a radiator or an oven. And so in the next slide, just as a bit of a warning, we're going to look at some of the injuries that people can sustain from these different types of burns. So Ginny's going to talk about a few of the patients that she's worked with directly. But if anyone feels a bit uncomfortable, then please feel free to look away at the following slide, because it is the content is fairly graphic.
Okay, so if we show you some images of the typical types of burn we see after somebody sustained a scald injury. So as you can see, you know, we're talking big surface area burns, largely with some of these scald injuries. The first image to come up there at the top of the hand is somebody who actually poured boiling water from a kettle over their hand accidentally whilst they were attempting to fill a hot water bottle, which is something that many people will be considering doing now as the weather starts getting a little bit colder. The image alongside that then is a lady who got stuck in the bath, and the hot water only had been run prior to her getting in, and unfortunately her mobility meant that she couldn't get herself out quickly enough to not sustain a burn injury. And then the picture at the bottom then is a lady, similar circumstances, but with a shower. So you can see the different distributions there as to where the water was in contact with the body. So as we said earlier, you know, older adults and the natural aging process can affect your mobility. It also thins the skin, so it doesn't take as long an immersion in hot water to sustain a nasty burn injury. So unfortunately, these are the sort of things that we're seeing an increase in prevalence of at the Burn Centre. So flame burn injuries then. This first image is a gentleman that was burning rubbish in the garden and his trousers caught fire. The image to the left of that is a lady that was smoking whilst using home oxygen. And the other image then of that hand and arm is a lady that was cooking at the gas hob, and the sleeves of her dress were quite loose and baggy. And as she leaned over the hob, the sleeve caught fire. And in fact, her whole dress caught fire. So her injuries are actually much more significant than just the hand and arm, unfortunately. And again, you know, these are all people that previously had been living at home independently. None of these people thought in a million years that they'd be sustaining a burn injury like this. You know, as Matt said earlier on, these are things that they can be avoided, but I think because people aren't necessarily ever thinking it's going to happen to them, you know, people don't put things in place to minimize that risk, unfortunately. And then we've got a contact burn then, which in older adults typically involves a radiator. So this is an image here of a lady who got up in the night to use the toilet and unfortunately had a fall and landed against a radiator that was on and was there for the duration of the night. She couldn't get herself up off the floor. Her skin was in contact with that heat surface for several hours before she was found by a family member the next morning. And I think you can quite clearly see the lines of the radiator on her skin there, showing you what type of injury that she's had. So again, a really, really nasty, deep injury that would have involved a long stay in hospital, at least one, if not more, surgical procedures, and then many, many weeks of rehabilitation and dressing changes afterwards. So none of these injuries are quick fixes, unfortunately. They're all going to involve a big hospital admission and lots of painful, anxiety-provoking procedures.
So the remainder of the presentation is going to focus on how we can keep ourselves safe and what to do in the event of sustaining a burn injury. So I'm just going to encourage you to think about what do you think, what burn first aid do you know, what do you know about minimizing the risk of sustaining a burn injury? And if you want to post anything in the chat, then feel free, and if not, then we'll move on to some of our suggestions on how to keep yourself safe. So I just want you to ask yourself a few questions. I want to think about the location of furniture in relation to heat sources. So what's recommended is a 4-foot zone of safety. So keeping furniture and toilets and beds 4 feet away from radiators, pipes and heaters. Now this is obviously potentially going to be difficult given space constraints in some houses, but it's the recommendation and it's something that we want people to consider. So as sort of another alternative, if this isn't possible, could be to put your radiator on at a lower temperature for a longer period, as opposed to whacking it up on as high as possible for a couple of hours and then turning it off. Another question we want you to ask yourself is, are your radiators and pipes covered? Because as we've seen from that last slide, the consequences of potentially having a fall in the vicinity of a radiator or a pipe are quite severe. Do you use an electric blanket or a hot water bottle, and are you using them safely? Hot water bottles are the kind of things that we quite often get out year after year without really checking up on. You need to make sure that it's going to be safe up there, and we actually don't recommend pouring boiling hot water straight into the hot water bottle like a lot of people tend to do, but actually leaving it to stand on the side for up to 15 minutes before putting it into the bottle itself, in order to prevent wear and tear and also minimize the risk of a really severe burn in the event of a breakage. And also electric blankets. We recommend using blankets that have a setting that automatically switches them off after a certain amount of time, as this, leaving them on all night is not what they're designed to do, and it's not safe or good for you. We also want to ensure that hot appliances such as irons are placed in a safe location to cool down after use. Now, this sounds like such common sense stuff, but the risk of cables hanging off the side of the table or leaving a hot object on a wooden surface are really significant, so we do need to draw people's attention to this fact. And also we want to encourage people to check on their fire alarms and their carbon monoxide detectors. They need to be checked every 6 months. You can ask for help from your family or friends or your local fire department. They're often the ones involved in maintaining and servicing and replacing these. So the highest risk areas within the home are the kitchen and the bathroom. So the next couple of slides are going to give you some specific strategies for things you can do within those two areas. So in the bathroom, the UK advice is that the maximum bathwater temperature should be 44 degrees Celsius. So at 49 degrees Celsius, it takes between 5 and 10 minutes to sustain a full thickness burn, compared to 2 to 5 seconds at 60 degrees. So 60 degrees is often the temperature at which water is stored within a boiler. And so if it arrives in your bathtub at that temperature, you can see just how quickly a full thickness burn could be sustained. So it's really important to know what temperature the water is stored at in your house if possible, and always check it. So we also recommend that people, when running a bath, add the cold water first, so you don't have an incident like we saw in that picture a couple of slides ago, and then you can add as much or as little hot water as you like. But in the event that you had a fall or a slip or you touched that water, you wouldn't be exposing yourself to that risk. And we want to encourage people to check the water temperature with a thermometer and not their hand. So there's a lot of different research into reasons behind this, but people with conditions like diabetes or with peripheral neuropathy, which is essentially reduced sensation in your fingers and toes, they might not be able to tell whether the water is too hot. And so the hand is not a reliable instrument to check whether or not the water is safe, because it might feel safe, but then you might be putting yourself at greater risk. And finally, do not get into the bath until the water is a safe temperature. This is really important. We're now going to look at the kitchen. And again, I'm just encouraging people to think about the things that we do every day and whether any of those things are putting us in danger unnecessarily. So think about your choice of clothing in the kitchen. Like we were saying, loose items of clothing, particularly over a gas hob, are likely to pose a greater risk. Think about where you cook. Everyone gets into a habit of using a certain hob, but we're really recommending using the back burners on the hob and turning pan handles towards the back in order to minimize the risk of you knocking that boiling hot liquid onto yourself if you have a slip or a fall or an incident. We want to encourage people to minimize distractions. Again, this sounds like such common sense stuff, but it's so important. So don't leave food unattended. Use a timer as a reminder so you know what needs to come out when, so you don't put yourself in greater risk within the kitchen. And finally, and keep the area around you on the hob clear of flammable objects. So things like kitchen roll or even oven gloves are potentially likely to catch light if you leave them too close. So we recommend a 3-foot zone of safety around the hob in order to minimize this risk. We also just want to make people really aware of the risks posed by everyday household items that we use all the time. So things like a microwave, these are amazing machines and they can be really helpful as it involves less processes potentially than cooking a full meal on the hob or in the oven. But they do also bring with them significant risks because as we all know, food in the microwave doesn't necessarily heat particularly evenly, and you're also potentially at risk of a steam burn as you open the packaging. So yeah, we're just really encouraging people to make sure that they use microwaves with caution and only put as much water in the kettle as you need so that you're not unnecessarily lifting up a full kettle every time, because yeah, the potential consequences of that exposure to the boiling hot water are really serious. So just as a sort of last little reflection, we just want you to ask yourself, am I doing everything that I can to keep myself safe? Or having gone through this presentation, is there anything now that you look at in your kitchen or bathroom and think, or maybe I'm not doing that quite as safely as I could be? So now I'm going to hand back to Janine, who's going to talk you through some burn first aid.
So I think we already gave you a bit of a clue in the patient's story as to what you should be doing if you do have a burn. In the first instance, if you want to put the image up there, Matt, for me, you need to be cooling that burn as soon as you possibly can under cool running water. We say cool running water rather than cold water because, again, as you age and your skin thins, getting too cold too quickly can actually be quite dangerous. So we don't want you to be too cold. The water just needs to be room temperature, cool enough to reduce the heat in that skin. If your clothing has been damaged during the burn injury, so either by the hot water or flame, you need to try and remove any hot, heat damaged clothing if you can, okay? If you can't, if it feels as though it's stuck to the skin, then just get under the cool water with the clothing on. The cooling mechanism is the most important, but in an ideal world, if you can remove any of the heat damaged clothing, that would be great. 20 minutes is a really long time. I think most people know that they need to put their hands into cool running water after having a burn, but I'm wondering whether that 20-minute time frame has surprised anybody. It is a long time, but that is the amount of time that our research has shown, and research all over the world has shown, is the most effective in preventing the heat from penetrating through deeper layers of tissue, okay? So it's not necessarily going to reverse the burn injury, but what it can do is stop the heat from penetrating more deeply and causing a more significant burn. Something else you might find surprising is the fact that it has been shown that cooling a burn can still be effective within 3 hours of sustaining the injury. Okay, so the sooner you administer the cooling water, the better. But if you can't do it straight away for any reason, don't think that it's not worth doing at all. As long as you can cool that burn within that 3-hour window, then it will still have an effect, a positive effect. So it is well worth doing within that 3-hour time frame. Once you've spent that time cooling the burn then, or if you've got anybody else around that can do the next stage for you, you want to be calling for some help. Now, the type of help that you call for will be different depending on the type of burn you've sustained. If it's a small isolated burn injury, then you could possibly go to your local minor injuries unit or even to your GP surgery. Anything really bigger than 50 pence, though, you probably want to be phoning 999 and explaining your injury to the call handler. If they think that you require an ambulance and you need to go to hospital urgently, they will send an ambulance to you. If they think that it's a small injury that could be managed more locally, they will advise you to act accordingly. But either way, it's always better to err on the side of caution. I would always get a medical opinion if you have had a burn injury, especially if the skin has been blistered or broken, and then the appropriate action can be taken. If you are going off to your minor injuries department or your GP surgery, covering the wound with some cling film is a really helpful thing to do. It's something that most people have access to within the home environment. And I'm not sure whether you all know, but cling film is actually sterile. so you're not going to contaminate the burn wound by applying cling film. It also won't stick to the wound, so then when you arrive at wherever you've gone to get your medical opinion, it can be easily removed without causing any trauma to the skin or any discomfort. And also, by covering the skin and all of the nerve endings that would have been exposed by the skin being damaged, it can actually help to reduce pain. So covering a burn wound with cling film can be a really helpful thing to do. Something to bear in mind though is that you don't want to be wrapping cling film around a limb. So if it's an arm or a leg or a hand or a foot, you want to be putting cling film on in layers or wrapping very loosely around. So you certainly don't want to be wrapping cling film tightly around a limb, because cling film does shrink. All right, so it can cause complications with circulation if you wrap cling film tightly around a limb. So it does need to be applied with caution. But ultimately, we want you all to remember today, if you take anything away from today, it's remembering the 3 C's, which is cool the burn, call for help, and then cover for protection. And we'll talk you through now some things that we really don't want you to be doing, but things that unfortunately we see, again, all too commonly here at the Burn Centre. So most people know that cool running water can be helpful after a burn, but we do also see things like ice or frozen vegetables, peas for instance, butter and toothpaste and all sorts of other lotions and potions being applied to the burn, usually after cold running water, to be fair. But we really don't want anything else applied to that burn other than the cool running water for 20 minutes. Ice can actually cause a skin injury in a very similar way to a heat injury. So it can actually exacerbate the burn and make the burn again deepen through the tissues. Butter, toothpaste, creams and lotions will all what we call mask and contaminate the burn. So anything that you apply to the burn is going to increase risk of infection, because once you've lost that protective barrier of the skin, obviously risk of infection is quite high. When you arrive for your medical attention, then anything that's been applied to the burn would need to be removed prior to the medical person being able to assess the burn. So any butter, toothpaste, creams or lotions would need to be scraped away from an already painful burn wound. So none of those things are going to give any benefit whatsoever. If anything, they're just going to cause more complications and more pain and trauma for the person who's had the burn injury. So cool running water for 20 minutes is all you need. And that brings us to the end of the presentation. So as we said earlier, any questions can be entered into the chat box.
Janine, Matthew, thank you very much for that. That was an excellent presentation, nice and simply put. And you know, I think we've all got some really useful take-home messages for all of us there. There's been some questions in the question box. Anybody got any others? Please feel free to enter them in now. I'll just pick up on a few of them so far. Roshnara Ali and Donica Reardon remind us that the well, locally, Mid and West Wales Fire Service offer free home fire safety checks, so smoke, heat, CO2 alarms, but also, you know, things around the home to do to prevent their starting a fire. It made me wonder whether you work with the fire service at all, Janine and Matthew, in you know, that prevention activity.
Yeah, I know Rosh very well. Hi, Rosh. Thanks for joining the webinar today. We've actually done quite a lot of joint working in the past. We've attended lots of wellbeing events and healthy aging events in the Swansea area and taken this burn prevention message out to the public. So yeah, we have linked quite well over the years and hopefully we'll continue to do so.
Excellent, excellent. I think when you were talking about what to do if you've got a burn, you know, and you showed the different things to do there. Carol Kelly was asking, what about burn gel? Don't recommend it?
No, I would avoid anything, to be honest, until you've sought a medical opinion. Okay, once you've seen somebody in the medical profession, they will advise you accordingly as to what you should apply. Now, these are for burns that have blistered or broken the skin ultimately. We all sustain really tiny, insignificant, very, very superficial burn injuries from time to time when we're using the oven and the iron and different things like that. So if it's the tiniest of burns and the skin hasn't broken or blistered, then potentially, but anything that's blistered or broken, nothing other than the cool running water until you've had medical advice, and then they will advise you as to what would be appropriate to apply.
Excellent, thank you. Alan Barham asks, are showers safer than baths?
The same message applies ultimately. So we tried not to confuse people too much actually during this presentation with throwing lots of different water temperatures at people. We find that most of the burn injuries that we see here, more burn injuries will be caused by a bath than a shower, I would say, with our older adults. Showers can potentially be safer, but there is still the risk of a slip or a trip. And not being able to remove yourself from that water source, especially if your shower's over the bath, for instance, you know. So there are risks associated with showers as well. And actually, the water temperature of a shower is recommended to be 41 degrees, which is slightly lower than a bath. I'm not sure why. But we didn't really want to throw loads of different temperatures at people. So I would say that we do see more bath scald injuries than shower injuries with our older adults. But I would also say that if you are showering, you still need to make sure that you're showering safely. So use a non-slip mat on the floor. If you need a handrail or a shower seat, then you need to get those installed and get them installed correctly. Possibly by contacting agencies such as Care and Repair can be really helpful for things like that. So yeah, I would say they both come with their own risks actually, but we do see more bath scalds than shower scalds.
Yeah, Kelly Williams was saying on their temperature controlled showers are brilliant, anti-scald showers, you know, that kind of way. We've even seen had a company come to us who color the water. We're using lights to let you know when it's an appropriate temperature and things. I guess, you know, you still need to take those with a bit of caution, but anything, you know, any additional feedback on temperature helps, doesn't it, I think?
Yeah, and there are agencies, I've already mentioned Care and Repair, but Age Cymru as well. They can point people towards different devices that can help to identify a safe water temperature. So we suggested thermometers because they're generally easy to get hold of and they don't need any sort of installation. But you can also get like these light color changing things that can be installed, and thermostatic mixer valves as well can be really, really helpful in controlling the temperature that comes out of your tap. But obviously you would need help to get those installed correctly.
Yeah, and I was just wondering, you know, have you seen changes over time in the types of burn that you're seeing come through to you? You know, are there different types, or is it always been the same kind of things we've got to watch out for?
Not necessarily different types, but what I would say is that we are seeing an increase in incidence in this type of injury with adults 65 and over, largely because we are an ageing population. So the population of older adults is growing and is going to continue to grow year on year. So we are seeing more older people in with us in hospital, which is a real shame because, as we said, you know, it takes people over 65 a lot longer to recover from these injuries than it does younger people. And also, you know, they are less likely to survive ultimately. So what could be a very survivable burn in a 20-year-old isn't necessarily going to be the same for a 70-year-old, which is why we're really focusing on the adults age 65 and over age group. As an organisation, the British Burn Association has done lots of prevention in the past with various demographics of people. So under 5s are one of our other most at-risk groups of sustaining a burn injury, but we've actually seen a really good reduction in those types of injuries over the years because there have been so many targeted prevention campaigns. And it's the same in industry, you know, we see a lot of we used to see a lot of industrial burns, but obviously since there's been tighter regulation and more health and safety focus, those injuries are dropping as well. So it's concerning for us that the injuries in adults over 65 has been rising. So this is something that we want to target our attentions to now, and hopefully have the same effect as we have with those other patient groups.
So you said they're rising. Is it rising across all the different? For example, do older people have particular types? I mean, you're saying they're more scalds than flame and contact being the top three, but is there particular types of injury older people have compared with the rest of the population?
I would definitely say that the injuries are more extensive, actually. So, we do see bath scalds in younger people occasionally, but because they're able to get themselves out of that water more quickly, the injuries aren't as deep and aren't as extensive. And it's the same with the flame burn injuries. If your clothing catches fire, we all get taught, don't we, as youngsters, that you need to stop, drop and roll to extinguish the flames, which a 25-year-old can easily do, but an 85-year-old can't necessarily get themselves to the floor quickly to put those flames out. So I would say that what we're seeing is that older adults have more prolonged contact time with whatever the heat source is, and that's what causes the complications with the injury then.
And perhaps just a final one from me. I was thinking, we talk lots about the physical complications of this and how long that lasts, but there's obviously psychological implications as well. And do you deal with that yourselves in clinic? Do you have to pass it on to anyone else, or you deal with both sides of physical and psychological implications?
Yeah, as occupational therapists, we are dual trained, so we will manage the physical and psychosocial aspects of a burn injury. We do also have a consultant clinical psychologist here at the Welsh Centre, so if anybody does need more in-depth psychology intervention, then we are able to refer on to her. But as I said earlier, we are a regional service at the end of the day. So again, if you've come from the very west of Pembrokeshire and had a big burn injury, once you've gone home, is your ability to travel back and forth to the burn centre to receive psychological care going to be there, on as regular a basis as you would be required to attend. So that was all in a pre-COVID world, obviously. Nobody can come to the burn centre now as an outpatient, or very few people. So we've got a really good team here. This is the best place to be should you have a burn injury, but ideally we would like to put ourselves out of a job longer term, and not be receiving people here with burn injuries, or certainly receiving fewer. Accidents will always happen, but ultimately a lot of these injuries can be prevented, and hopefully we've given everybody some ideas as to how they can minimise their risk within their home environment, so that you can continue to live independently at home, doing all of the things that you want and love to do. So
just one last question coming from Kelly Williams here, just talking about, do you have any statistics around how more likely it is for people with sight loss who maybe they have different types of burn, or more likely to be susceptible to burns, or perhaps think about any other hearing loss or anything like that? Does any change in cognition as well make it more likely people have burns?
Yeah, absolutely. Those are the types of things that we were talking about when we referred to the natural aging process, because obviously vision and hearing loss is more common as we age, as is cognitive changes. But we do have younger people that have got vision and hearing loss as well, and yes, they are at more risk of sustaining a burn injury. It depends how well supported you are in the community. So if any of those impairments have been identified and you've received appropriate support and you've had housing adaptations and different devices installed, that will obviously increase your safety. The risk increases for people who aren't accessing those services and getting the help that they need.
Question here from the Northeast and Cumbria Burns team, Fiona Tottenham Mitchell from Newcastle.
Hi,
greetings to Newcastle. She really enjoyed the webinar, so thank you for that. But what are your thoughts on weak packs rather than hot water bottles?
Yeah, that is the age-old question for us in burns, isn't it? I mean, we've been discussing this on Twitter this week, the perils of using hot water bottles. So, you know, people do think that a wheat pack potentially could be a safer option. However, we have also had people admitted to the burn centre that have sustained a burn after using a heat pack, mainly because they are heated in the microwave. So again, as we talked about earlier, the microwave can heat things unevenly. So although when you remove the heat pack from the microwave, the edges might feel potentially cool enough to apply, when you put it on, maybe the central bit is a lot hotter, or vice versa. We also will have people that just put their hand in the microwave to remove the heat pack directly, and again, you know, get the contact burn from their hand there. So it's a difficult one, isn't it? It is a difficult one. I think people need to be taught to use both types of heating device safely, because people will always want that comfort from some sort of heat application, but it's just trying to ensure that people are getting the message and how to use them safely.
Brilliant. Right, well, I don't think there's any more questions on there. Did you want to have one parting sentence each to finish the seminar with, to remind us all as we go on our merry ways? Matthew, did you want to conclude with anything?
No, I think it's all been covered, really. I think I'll just emphasize the point that the vast majority of burn injuries are preventable, and that there are things that we can do every day to minimize the risk to ourselves and to those around us of sustaining a burn.
Great, thank you. And Janine, any last thoughts?
Cool cover, I think. You know, first aid can have such a big impact on reducing the significance of the burn injury. So that is the thing I would like everyone to take away today.
Brilliant. Well, thank you very much, Janine. Thank you, Matthew. Thank you, everyone to the in the audience today. Hope you've enjoyed that. It was very informative, very useful, very practical, quite easy things for us all to remember and take home with us. So thank you very much for your time. Just to remind everybody who's been viewing this to fill in our evaluation and feedback forms that you'll get an email to all of you for. It really helps with us, so that we know how to plan for these things in the future and to make sure the technology is working in this day and age as well. So without further ado, thank you very much, and hopefully see you all again at the next CADA seminar. Which
sorry, Charles, sorry to interrupt.
Yes, Matthew, yes, last thing.
Can I just say that we'll also be sending out the same questionnaire again in a subsequent email, and if you wouldn't mind, please filling in that, because it will be so useful to contribute to our research. So it's the same questions again, and yeah, good luck.
Brilliant. Well, thank you very much, everyone, and have a nice rest of the day. Thank you.
Thank you. Bye.
Cheers.